What's up, guys? Wanted to jump on again today, kind of going with yesterday's theme about assumptions. So the question I posted as the title of this video is back pain and core strength. Does it matter? That's a commonly blamed culprit of back pain. So can it be the problem? Totally, yeah. But there's also cases where it's not relevant. So I wanted to give you guys a little case study about an eval I had today. So female, multiple kids, C-sections, has back pain, sometimes central, sometimes to the right side, has been to PT multiple times. What else is relevant? Overall pretty active, multiple activities, pretty much all of them bother her. All previous PTs that they have been to, what's up, Greg? All previous PTs that they had been to were all, core, get your core stronger. And she said that it had helped, but it never really made the problem go away. It kind of turned the volume down, so to speak. Hey, Mitch. No, Greg, I'm not talking about you. Unless you had 3 kids that I don't know about. I don't know where I put her notes. Here they are. So, yeah. She's having these back symptoms, so, been to PT a bunch of times already. Hey, Andrew. Been to PT a bunch of times already. They've been focusing on core, so I tested her core. I mean, what else are you going to do? So, I got the table right here. What I had her do is I had the upper half of her trunk, so everything above the waist, hanging over the edge there as I held her feet on the table. She held a back extension. We got to a minute, and she was like, what are we doing here? I can go here forever. So her back extensions were strong. That's not an issue. So flipped her over, supine on her back, had her do sit-ups, legs straight. I held her legs down. She knocked out 10 sit-ups, no problem, full. Again, piece of cake, no problem. Could have kept going. Core's not an issue. Could it be? Not for her. We tested it. She's strong. What was relevant was about a 15-degree difference in hip abduction range of motion, about 10-degree difference in hip internal rotation range of motion side to side, another about a 15-degree difference in hip external rotation range of motion side to side. Her straight leg raise, there was a 25-degree difference side to side. And in terms of her back, like I said, core strength was totally full, totally strong, not full. Range of motion was full. There wasn't any motion loss there. What else is relevant? Scattered weakness all throughout the hips. So I'm going to treat her hips. I'm going to get her hips more mobile and strong. That's what we're going to do. The biggest thing about this is that I want you guys to know is, after going through the summary of the exam and the findings, she was like, thank you. Like, this finally makes sense. All these years, having problems and pain post-pregnancy and all that, people were telling me, get your core strong, do this, do that. And yeah, that's logical, but did anyone ever test that with her? I hesitate to say that they did. I think they just kind of assumed. And just like the theme yesterday, it's like you can't assume. You'd be surprised what you find. This person, I'm not going to name off the activities, but there's a whole list of them. 1, 2, 3, 4, 5, like 6 different forms of exercise that this person does, and still having back pain. Obviously the core was strong, so there's got to be something else playing into that. It's not just, they're not working hard enough, or the core isn't strong enough and needs to get even stronger. There are deficits here. It's just they weren't previously being focused, where they could be. So yeah, the theme continues. Don't assume. It's test the person, see if that correlates with what they're telling you, and if it doesn't, look elsewhere, or if it, if it lines up with whatever your hypothesis or bias is, coming into the situation. So yeah, I just want to jump on and talk about that because I mean, again, I get a lot of people that have failed or haven't succeeded elsewhere, so I kind of get the benefit of knowing something failed and not having to start with that strategy. But even if I hadn't, let's say I did start with core strengthening with her and it wasn't improving her symptoms, I mean, I'd give it 2 weeks tops before I changed it up and looked elsewhere. But if I did a thorough eval like I did and today, I know where else to look and target some things where those deficits are. So yeah, again, moral of the story: don't assume. Hope that helps you guys. Any clinicians that are watching out there, young clinicians, and maybe even some older ones. And if you guys are having any pain or know anybody that hasn't had a good therapy experience, I promise you will get a different one with me. So yeah, have a good weekend. Talk to you guys soon.